So yeah, as Kit mentioned, I'm just going to do an overview of the environmental health program at the Northwestern Health Unit. And these are kind of just a brief overview of what I'll be discussing today. So the environmental health team, so we're primarily located in our major three offices. So that's Fort, Kenora, and Dryden. We do have Amy, who is also in Atikokan, but for the most part, the rest of the staff are in those offices, and we service the region from those specific three offices. So Dryden, as you know, on the slide, services kind of the northern Kenora district and to Ignace and English River, Pickle Lake. Fort Frances does the whole south end up to Nestor Falls. And then Kenora services the Kenora, Clearwater, Moonachie, and Sioux Narrows area. Our PHIs are regional. And then we also have other regional staff, health educator, health promoter, and a tobacco enforcement officer that service the entire catchment area. And then we also service unorganized territories as well. So our environmental health team is comprised of public health inspectors, tobacco enforcement officers, one health educator and one health promoter, and then myself as manager. So this is our team. It's not a huge team, but it's not small either. Yeah, so right now we have two positions that are currently open, a public health inspector position in Kenora and a tobacco enforcement officer position that could be at anywhere. But for the most part, a lot of our staff have been here for quite a while now and haven't had a lot of turnover, which is really great. So for the Ontario Public Health Standards, so I just kind of put in a little bit of a summary of the standards and all the guidelines and documents that are associated with them. So there are 10 public health standards that the province has put out, and the environmental health team currently has requirements under 8 of them. Of the 23 public health protocols that we must follow, we have requirements under 14 of them. And under the guidelines, again, so 13 out of 20, and for reference documents, 10 out of 14. And I think part of this is because a lot of the work that we do is so legislated and mandated. It's easy to put a lot of this stuff under guidelines and requirements and protocols, but it just kind of shows the scope of work and the amount of knowledge that our staff have to have in their head as they do all their different programs. So as Kit mentioned before, it is a fairly large scope that the environmental health program has. So these are the list of programs that we're responsible for. So your general inspection programs such as food safety, safe drinking water, recreational water, health hazards, smoke-free, skin cancer, Healthy Menu Choices Act, and then we have other programs such as healthy environments, health hazards, vector-borne, rabies. And the majority of all these do have specific requirements in the staffing that have to do the work. A lot of it is legislated that public health inspectors have to do the follow-ups and inspections. And we've been able to transition some of the work that isn't mandated by public health inspectors to our health educator and health promoter to allow to ease the kind of and move the work around a bit. So what I'm going to do is I'll go through briefly each kind of some summary of each program, just kind of the highlights of what each one is. So for food safety, so this is our inspections. So we are responsible for going into every premises that sells or serves food to the public. Special occasion food permits. So this is something that has skyrocketed, especially this year. So anyone wanting to sell food to the public who doesn't have a fixed premise is required to fill out one of these forms. So that can be anything from a charity barbecue that a business would like to put on to farmers markets applications where anyone wanting to sell at one of our markets has to fill out, and that's again under farmers markets right there. And then we also follow up with any kind of complaint, whether it's from businesses, from public. We provide food safety training, so our health educator is responsible for that. Right now, we offer it in person in each of our communities, sometimes more than once, depending on how many people want to take it. And then we also do it online as well. And then foodborne illness outbreak management. So if there's any situations where a bunch of people get sick because of something that they ate, we're responsible for going in, figuring out what that food item could have been, whether it's associated with a specific place or a specific event, and then coordinating with the infectious disease team through the outbreak management and the people involved. Safe drinking water. So one of the biggest things out of this program is small drinking water system inspections. So a small drinking water system is any establishment that provides water to the public that is not on municipal services. So this is a lot of our tourist camps, gas stations on the highway. Even we have home-based businesses that are on non-municipal services. So they're required to follow specific requirements for sampling and treatment systems to ensure that they have good water quality when they provide it to the public. We assist the dental team in terms of monitoring community fluoride. So if there's any issues with the levels that in the communities that do fluoride, we work with the water treatment plants to ensure that they're bringing them back up or working with them if there's any issues. Public-private water testing. So this is something that the Public Health Lab offers. Anyone can sample their water, their private home water, and send that off to the Public Health Lab, and we assist with the shipping and organizing of that. Blue-green algae response, which is becoming fairly popular and common in our region now. So working with the Ministry of Environment on blue-green algae in the lakes, providing safe water education for our operators, and waterborne illness outbreak management. So similar to food safety, this is illnesses that are due to waterborne illness. And one thing that I didn't mention in here is, which is on the list there, is municipal adverse water quality events. So anytime there is an issue with the municipal water treatment system, our staff are involved with that and making sure that the proper procedures are being followed, as well as if there's any risk to the public. We work with municipalities to issue boil water advisories and advise them on next steps for that. Recreational water, so this is specific to pools, hot tubs, splash pads, wading pools that are used for public. So that could be like your rec centers, hotels, community facilities, stuff like that. So we inspect all of those multiple times a year to ensure that they're meeting proper requirements and legislative standards. And then we do beach water surveillance as well and recreational water complaints. So for beaches, we did suspend the beach sampling program a few years ago. However, we're still responsible for any complaints, any adverse events relating to water quality at a beach. And we do each year inspections just to make sure that there's proper signage in place and there isn't any hazards that are noticeable. Health hazard response. So part of this is inspections we inspect all recreational camps. So those are kids camps in the area. So we have a few throughout our region, and also camps in unorganized territory. So these are work camps, which include forestry camps, mining camps. Those are the two big ones that we have. And if they're not in a municipality, then there's a legislation that they have to follow in terms of making sure that they have adequate sleeping facilities, adequate water facilities, kitchen, all that stuff to ensure that it's a safe environment for those workers to be in. Boarding house inspections, again, so just making sure that the common areas of a boarding house, such as the kitchen, washroom, stuff like that, meet legislative requirements. And then health hazard complaint follow-ups. So this one's a little bit gray. We try to focus mainly on public places where we do get calls from private individuals, or private homes, or landlord-tenant disputes in terms of issues of mold and stuff like that. So we mainly provide education in those situations. Healthy Environments is more of our health promotion based program. And this is primarily run by our health promoter and focuses on environmental exposures to UV radiation, radon, air quality monitoring. So this is one of the big things that happened this year was all the forest fire smoke, especially in Southern Ontario, that put in a lot of procedures and discussions around exposure to forest fire smoke. And one benefit that we were able to move forward with is partnering with Health Canada and UNBC in BC to install air quality monitoring units we're working on in each of our offices so that we can get a better sense of what the air quality is like in our large geographic area. Because the closest provincial air quality monitoring station is in Thunder Bay, which isn't super helpful to be able to provide information to us. And then we also collaborate with municipalities, support changes to improve health outcomes, which is kind of built into the built environment too, which focuses on many different aspects like lighting, transportation, access to parks, stuff like that. Vector-borne disease. So as many know, the ticks is probably the biggest thing in this program. So we do surveillance for tick-borne diseases. We actually just wrapped up our fall tick drag in the South End, which our staff go and spend about 3 to 5 hours a day dragging through the bush trying to collect ticks, and we collect them. We send them off to the National Lab in Winnipeg, and they sample them, and it kind of gives us an idea of what diseases are present in our region as well as the infection rate for them. So we should get that data back in the new year, and that kind of informs how we educate both the public and also our healthcare practitioners in the region. And then West Nile and Eastern equine encephalitis surveillance is also done each summer. And that's where we set up traps to trap mosquitoes. And we do that each week during the summer months and send that to a lab and get surveillance data for that too. Rabies and other zoonotic diseases. This is primarily animal bite follow-ups. So anytime that an animal, whether it's an owned or wild, bites an individual, and it has to be reported to us, and we have to follow up to determine and work with the medical professionals whether or not rabies vaccine should be administered, and making sure that also if it's a pet that they follow strict quarantine rules for the animals. And then there's other viruses that also fall under this, such as avian chlamydiosis, avian influenza, and Echinococcus multilocularis, which are other zoonotic diseases that thankfully are not very much present in our region, but still something that we have to keep surveillance of because they are in other areas, such as I think there was one in northern Manitoba a couple of years ago. So it's not specifically in our area, but we just have to keep an eye on it. Infection control in public premises. So this is primarily inspections of personal service settings. So that's like your hair salons and aesthetics, tattoo parlors, stuff like that. So we go in there once or twice a year, depending on the risk level, to ensure that they're following all the infection control procedures. IPAC lapses, which are generally complaints that come in, and they're mainly around professional clinics, such as doctor's offices, dental clinics, stuff like that, where the public feels that there's an infection control issue. So then we have to go in and do an investigation, work with their regulatory bodies to ensure that they're following proper procedures, and just to make sure that everything is good. Outbreak management, so that's working with the ID team to support outbreaks in our hospitals, long-term care homes, and other congregate living facilities, and then supporting IPAC hub work with our health inspectors as well. This one's definitely a smaller program, the Healthy Menu Choices Act. So this came in a number of years ago, and we don't have a huge amount of development in our region, so we don't see a lot of new chains of restaurants. So this only affects places that have more than 25 locations in Ontario. So it's like your McDonald's, Tim Hortons, A&W's, stuff like that. So we only have to go in and do an inspection when a new place opens, and then follow up with any complaints that come in, which I don't think we've had a complaint yet for this. And that's similar to Skin Cancer Prevention Act as well. It's a complaint-based inspection, and any new tattoo or sorry, not tattoo, tanning facilities that open up, we have to go in and do an inspection, ensure that they have proper signage. And the main goal of this is to ensure that children under 18 don't use these facilities. Smoke-Free Ontario, Act. So the environmental health team has the protection pillar of this program. Cessation and prevention are completed by the CDP team. And this is the tobacco enforcement officer, and it's more regulatory based, which is why environmental health has this program, and involves staff going into anywhere that sells tobacco and vape products and ensuring that they meet all the regulations for how they display them, what products they can have. And then we also do youth access. So we hire kids that are between generally 15 and 17. We send them into the stores that sell these products, and then we try and get them to buy. Well, we don't try and get them, but we want them to avoid buying them. But it's basically trying to find out who's selling to minors. It's really important to be able to do this work, because the goal is we don't want any minors getting access to it. And it still happens, but basically if vendors don't sell or do sell to the products, they kind of have a tiered system. If they get 2 charges, then we're allowed to do an automatic prohibition, which is completed by the Ministry of Health. So it's not our document, but it prevents them from selling cigarettes for 6 months. And if they get another charge after that, then it goes up to 1 year, then 18 months, and it just kind of escalates. So there is definitely, it's not good if they sell to minors. We're also in charge of registering all specialty tobacco and vape stores. So there's a registration process that happens each year in January, where the stores have to provide us with all the information, including accounting work, to register them. And then we work with the schools to ensure that students aren't smoking on school property, and also multi-housing, and then tobacco complaints for prohibited locations. And those are like your playgrounds, schools, sports facilities, and stuff like that, where you have to be a certain distance away from the property lines on those. And then lastly, Part 8 under the Ontario Building Code. So this is a completely separate program out of the OPHS, and is done through the Ontario Building Code. So the Northern Health units all have Part 8 under their portfolio, and each one. And I think it's mainly because we are the sole agency that covers both in municipalities and unorganized territories. So it kind of makes sense. And we're legislated under the Ontario Building Code to provide this service. So I have 4 staff that go out and do inspections for all septic systems that go in, whether that's a gray water system all the way to a full septic system, follow up with any complaints in the area. We also have a huge role in land development approvals. So anytime there needs to be a subdivision, or someone's looking to sever their property and is on non-municipal services, we have to be involved with going out and doing inspection, ensuring that they can fit septic systems on their properties. Performance level reviews is we look at if someone wants to put a large addition onto their house and whether or not that addition will affect the performance of their septic system and whether they need to provide upgrades to it. And then permit searches are, we keep a database of all the permits for 35 years and provide a service to give people their permits if they don't have it. So with all of our programs, one of the big things that we implemented in, I think it was 2013 was our online ChooseWise program. And then we since expanded that in 2019 to our on-site disclosure for certain types of premises where it's legislated in our regulations, which is food premises, personal service settings, and recreational water facilities. So it was released just prior to the pandemic. So unfortunately, we weren't able to get to every single place since then. And that's what we're working on this year to ensure that every one of our premises has been inspected since 2019, because we took a hiatus for a few years during the pandemic for inspections. And we'll do an education campaign in the new year, focusing on the signs and what they mean, what people should look for. And then we also disclose other things such as all of our Provincial Offense Act offenses and automatic prohibitions for our tobacco program, IPAC lapses, and also any blue-green algae events is on our website as well. So program highlights. So as mentioned before, one of the big things in the last year that we did was we developed in partnership with Communications, an external learning management system. So this is allowing us to develop our training programs online that meet both the requirements of the province and also AODA standards as well. So we launched our food safety training in August of 2023. And we're actively working on our next courses. And these are required courses that are in the standards that operators have to have. And one of the things that we looked at was there's not a lot of opportunities in our region or even in the Northwest for these operators to get this training. A lot of them are only offered in Southern Ontario, require a lot of travel. So we wanted to try and find something that met the requirements, but also give opportunity for the operators to do it without having a lot of issues or burden to them. So that's a rec water operator course that we're developing, a small drinking water system operator course, and a personal service setting operator course. And then also working on a condensed food safety course, which I believe the province is actually now looking at. So we're going to hit pause on that one. And that's mainly for places that are people who don't require it to have it in the food safety reg, but want to learn about it, like if they're doing a special event or student nutrition programs or something like that. So this is just a snapshot of 2023, and this is to September. So I didn't update it to date, but we have just under 1,700 premises in our area that require inspections. We need to do each year. So some of them aren't inspected each year. Some are on every 2 years or every 4 years. But in total, we have just under 1,500 inspections that have to be completed, which is an average of 213 inspections per inspector. And just to get an idea, it's about, on average, about an hour and a half per inspection for each inspector. We had 301 special occasion permits issued to date in September, and that is more per capita than inspectors in Toronto Public Health. 405 service requests since September, and from January to September, 140 animal bites. We've issued 25 Part 1 charges in the Smoke Free Ontario program, and I think we just issued another 7 in October. And we've put on 1 automatic prohibition in 2023 in Atikokan. And then we followed up on 26 institutional outbreaks so far, and I think we've had about another 8 in October. This is the busy time of the year for institutional outbreaks. Now, so October, November, and December will be quite a lot for the inspectors. Some of the challenges that we have, an increase in home-based businesses wanting to prepare food or personal service settings as well. Part of this is because of the red tape reduction regulations that were introduced in 2020 by the Ontario government. And also a lot of people trying to do second jobs or side hustles, I guess, and just like whether it's baking or stuff like that. But it's incredibly time consuming to do these places, especially ones that are trying to do different kind of things, such as like canning, which is very time intensive for us to do, foraging of wild mushrooms or other kinds of things that we then have to go through in a risk assessment process. Things like chaga teas or kombuchas, which are, it's very challenging to make sure that they're following all the proper requirements and that it's a safe product for the public to be sold. An increase in the amount of special events that we've been having. The other thing is, which we haven't really got a handle on yet, is Facebook, which is a whole can of worms in itself of people just selling stuff on Facebook and being able to access those people because they don't have addresses, they don't put phone numbers in there. So it makes it very hard to track those individuals down, and also seeing it on other social media sites. Complexities of health hazard investigations. So I know 2 of the big ones that we're working on right now is hydrocarbon issues as well as PFAS, which is, I'm not sure if you've heard of PFAS, but it's becoming in the news a lot now, and that's polyfluoral alcohols. And those are like Teflon is considered PFAS, and PFAS is basically in every single thing we have, like clothes, products, like kitchen utensils. And in the 80s and 90s, it was used in such things like firefighting, like to put fires out. So that's where we're doing investigations right now, where sites were used for firefighter training that potentially has impacted lakes and water wells and stuff like that. So we're working with Transport Canada and Ministry of Environment on investigations in our regions for those. And then rebuilding relationships with the operators and partners post-pandemic. A lot of our people that we inspect and operators that we inspect, we had to switch gears during the pandemic and work with the Reopening Ontario Act, and we closed a lot of these places and put a lot of a lot of hardship on them with requiring very specific changes to how they do their job or how they do their things, and trying to rebuild that now of going in and going back to kind of our regular inspections. And as such, working through inspection and training backlogs because of the pandemic. Understanding links between air quality events and health messaging with minimum data. So that's where we're working on getting air quality units in our region to be able to better assess that. And then just extraordinary travel time to reach inspections. And I think I put a couple pictures in there where we, from the air, like our inspectors go in planes, boats. I think our furthest inspections 6 hours north by car one way. So although we don't have as many inspections as, say, other health units, the amount of time that it takes to get there really impacts how many staff, like the staff time involved for it. So ongoing and next steps. So we're restarting our Healthy Environments program. So that's this year, and building relationships with municipalities, continue to support one-off health hazard investigations, and continue to refine our processes to assist in efficiency and clarity for our public and operators. And that's constantly tweaking things on how we manage our IT stuff, and our forms and stuff like that to make it as streamlined as possible and as easy as possible for our operators to be able to meet the requirements that they need to meet, or with our special events as well. And then continuing to reach our 100% inspection targets as required by the Ontario Public Health Standards, and then continuing to recruit for staff for empty positions.